Hello everyone, I'm Terri O, host of Sonoran Living, and I want to welcome you to Checkup AZ. This is a very important streaming special, and I'm so glad that you are joining us. I really want to thank our sponsor, Pella Windows and Doors of Arizona, for helping us bring this very important message to you about breast health and early detection. As many of you know, I was diagnosed with breast cancer about a year ago. And after surgery and radiation, I'm happy to report to you that I'm cancer-free, which is wonderful. There might be some tears during this streaming as well. But what I've learned from my journey is that I am one of the lucky ones. And you're thinking, well, if you got cancer, Terri, how could you be lucky? Well, here's why. I caught it early. I got mammograms every single year, ever since I can remember. And I went and got my mammogram, as I always did, and I ended up with stage 1 ductal carcinoma. Now think about that. In 1 year's time, I went from perfectly fine to stage 1. And the reason why I'm the lucky one is because I caught it early. Had I waited 6 months, 8 months, maybe a year, like many of you do, you put it off, I could have easily been diagnosed with stage 2, 3, or 4, ended up with not only radiation, but chemotherapy. That's why I consider myself one of the lucky ones, because I'm proactive. And the message today is for you to be proactive too. This whole show is about early detection and the importance of why you need to know your breasts. We all have them, men and women, and I want you to know them. So my amazing guests this morning are going to teach you so much information, signs, symptoms, the importance of early detection, and what to do should you be diagnosed. So let's get started. I want you to meet my guest today, Dr. Corrine Ellsworth-Beaumont. She is the founder, designer, and creator of KnowYourLemons.com. Also an app. We're going to talk about that in just a moment. I also have Dr. Erin Bravo. She is a breast specialized radiologist with Solis Mammography. Welcome, ladies.
Thank you so much for having us.
Oh my gosh, this is going to be no holds barred here, right? We are talking about breasts for the next 45 minutes, everything you need to know about early detection. So, Corrine, I want to start with you because...
let's get into this.
Know Your Lemons. When I first went to your website, I was blown away because of the information you put right out on the screen, signs and symptoms. And we're going to show it, but it's basically an egg carton of lemons with 12 different signs and symptoms that I didn't even know existed. We're all looking for a lump, but there's way more to it.
Yeah, absolutely. We're all told to look for a lump when it comes to checking ourselves, understanding the symptoms of breast cancer, right? But there's actually 12 things to know. And by looking at one picture for like 30 seconds, your knowledge is going to go from like to like,
0 to 100 really fast.
And like you said, like you were blown away. And you know, this is why our image is so popular on social media. It's why our app is getting lots of downloads. You know, we have a simple way of explaining this. So I want to kind of explain like where this lemon idea even came from. Right. So I was starting my master's degree in graphic design. I was in my early 20s, and my second grandmother died from breast cancer.
So you lost both your grandmothers.
So I lost both of my grandmothers to breast cancer.
Wow.
And I started to think, well, is there something I should know for me?
Right.
Like, am I at higher risk for getting breast cancer? Should I start mammograms now? Like, people say to do self-exams and check for a lump, but like, I feel lumps when I do a breast exam. And
so what am I looking for is what you're thinking, right?
And like, it's like in school, we talk about every part of the body except for breasts.
Yes.
Right? Like, I know all the like parts of an eyeball, and I know that you shouldn't take steroids because it can shrink your testicles, right? Like all of this random stuff, right, that we learn about in school. Breast cancer is the most common cancer in the world now, and we are sent off into the world knowing nothing.
Right.
Like, and it should not be that way. So I was thinking, you know, it took 2 family members dying from breast cancer before I decided to get interested about it. So I had those 3 questions in mind, and I started looking at information and realized those answers weren't in one place. And I thought, what if I could use design as a way of being engaging? So the bar wasn't set so high to learn about it. And I could design information in a way that people would go like, what is that? I'm interested, like, oh, now I'm educated. So that's where this Know Your Lemons campaign started. Over 20 years ago, I came up with this crazy idea of using these lemons as a visual metaphor for breasts so it wouldn't get censored.
Right?
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 Such a good idea.
Yeah.
For like, hey, this is what an inverted nipple looks like, then
Because
it's
you
not going
can't
to be
show a
shown.
breast on TV.
It's not going to go anywhere.
Right. I mean, that's a challenge I run into all the time because I can't, there's a lot of things I can't say and I can't show.
Yeah.
And so you made it not only visual, but very simple and easy to understand where the light bulb goes off, right, in your head. And I want to talk about the fact that this was 20 years ago. A lot of information has come across since then. And I want people to know that what they're learning on your site is it's been researched and it's accurate, correct?
Yeah.
Okay,
So
that's super important.
My PhD is in how to communicate this very topic to a global audience.
Who knew there was a PhD in
I
that?
know, seriously.
So how can we use design to make things easier to understand by using visuals? That's where my specialty is.
So then from there came the app. And the app is super important because once you download it, it sends you reminders, but there's so much information and we're gonna get more into the information part of it. But the signs and symptoms, if you go to the website, you'll see exactly what I'm talking about. But early detection is self-exams first and foremost.
So it starts with knowing what's normal for you. So a self-exam is not a hunt to find cancer. If that was the case, no one would want to do that.
Right, that's not what you're looking for.
That's not a trip I want to go on, right?
Self-exam is to know what your breasts are,
It's
right?
to know what's normal for you,
Yeah.
right?
Okay.
So that way, if there's a change, you go, I know this wasn't there before. I know this is different.
And by the way, I want to mention that your website and your app instructs you on how to do the proper self-exam, which is also very important, right?
We have Mona Lisa, who's been doing self-exams for over 500 years, and she will talk you through what each part of the breast typically feels like, right? Because we didn't learn about breast anatomy in school.
Yeah.
We don't know about all of the like ducts and lobules and everything that is inside of a breast. And so when we're doing a self-exam, we go, oh, well, this is kind of lumpy here, it's kind of lumpy there. At different parts during our menstrual cycle, things will swell and get tender, and they like our breasts get chatty. And then that's when we start to go like, ooh, what's this? That's not the right time to do a self-exam.
Right.
You need to wait till a couple days after your period ends when the hormones are like
Calm down,
yes,
right?
And compare that like for like each month. And that's what the app does, is it sets it up. And then if you don't menstruate, it's like, hey, it's the first of the month, fill it on the first.
Just do it.
And it just sets that routine up for you so you don't have that mental load of like, did I check my breast this month? Just wait for the app to be like, hey, it's time.
And the thing to remember too is that we're all different. And so it's important that, somebody could be telling you, oh, I feel this and I feel that, but you know, because they're yours.
Absolutely, yeah.
So here's what's interesting. I did not feel my lump, Dr. Bravo. I found it through a mammogram.
Right.
So let's talk about, we do self-exams, we get to know our breasts, but a mammogram is key, critical.
It absolutely is. First of all, I want to say props to you for having your mammogram every year.
Thank you.
That is so important. So unfortunately, some women do find it on physical exam, but the point of a mammogram, we want to find it before anyone can feel it. So at the age of 40, for women that are at average risk for developing breast cancer, we recommend getting a mammogram every year. What we are trying to do is, like I said, find a breast cancer while it's still stage 1,
Right.
before you could ever feel it, because
I even know
it's too
someone
who
who found it at stage 0. So it's possible, right?
Oh,
through a mammogram to
absolutely.
find it even at stage 0.
Yes. A lot of the cancers that we find with screening mammography are still at stage 0 or stage 1.
Wow.
So if you are getting those regular mammograms, the chance of a breast cancer being cured is so incredibly high.
Yes. Let's talk about, because there's a good time and a bad time, the wrong time to do self-exams. is there a wrong time to do a mammogram? Like if you're still menstruating, should you avoid that time? Or?
So not necessarily.
Okay.
We recommend just making sure you get a
do
mammogram
it.
every year. Yeah,
Don't use that as an excuse.
Exactly,
right?
exactly.
Okay.
You know, as you're leading up to your getting your period, your breast will be more tender, and so that will make getting the mammogram more challenging, more uncomfortable.
Yeah.
Also, a lot of women get cysts. Cysts are completely benign and nothing to worry about. Essentially, every woman will get a cyst at some point in their life. Normal breast tissue produces fluid. The fluid will accumulate into pockets called cysts. On the mammogram, so like I said, you are more likely to have more cysts and larger cysts as you're leading up to getting your period and when you have your period.
But they go away.
But they do go away.
Yeah.
But on the mammogram, we can't say that they're cysts. We see an area that looks different than it has before and different. It looks different than the rest of your breast tissue, but we can't tell that it's a pocket of fluid on the mammogram. So it could potentially increase your callback rate. So getting called back from having that screening mammogram, getting an ultrasound, and then ultrasound, we can tell, is this a pocket of fluid or is this something that we need to worry about?
So what I'm hearing is don't freak out.
Absolutely.
Okay,
Yep,
don't freak
definitely.
out.
Yep.
Okay, a couple things. Let's dispel a few myths about mammograms. There's so much stuff out there on social
love
media, and I just want to say, you know, do your research. I mean, the information that we're giving you today is so solid, and the importance of doing any type of screening, I cannot emphasize enough. But a lot of women are hearing, don't get your mammo because it's too much radiation, or it's going to hurt. Or, they're scaring us. So tell us what to do.
So mammography is absolutely the most important thing you can do to find breast cancer early. It just is.
It is.
This is backed by years and years and years of research. So a couple of things. First of all, I always tell my patients that are questioning if they should have a mammogram, I say to them, it's your body. You get to make a decision that's best for you. But something that I do want them to know is I want them to have the accurate information so they can make an educated decision that's right for them.
Right.
So a mammogram is so important because it is the only imaging modality that has been proven to decrease death from breast cancer. So it is, like I said, is the most important. And some of the earliest, those stage 0 breast cancers, we only see those on mammography. We don't see them on ultrasound.
What about an MRI?
We don't see it on MRI a lot of the time.
Okay.
So the earliest changes in someone's breast tissue are found on mammography.
Okay.
So hands down, mammography is the most important. Yes, you do get a small dose of radiation. It's almost negligible. You get the same amount of radiation. You probably didn't know this, but we are all getting radiation all the time.
Right.
The higher up we go, the higher up we go in altitude, the more radiation we get. So anytime you take a flight, you're getting radiation, a small dose of radiation. No one ever thinks about that. Nobody ever says, I'm not going to fly to New York City because I don't want the radiation. So the amount of radiation you get from having a mammogram is the same that you get flying from LA to New York City. So it's essentially negligible.
That's unbelievable.
And it absolutely does not cause breast cancer. I can't stress that enough. It does not cause breast cancer.
Thank you for saying that and being emphatic about that statement, because there should be no reason why you should avoid getting a mammogram because of that.
Because of radiation, yes. Yep.
Yes. And
I will say it is uncomfortable.
Okay, so I want to talk a little bit about that.
We all get our mammograms. Yeah. It is uncomfortable. Nobody loves doing it. It's sort of, I always say it's like going to the dentist, right?
And nobody wants to do that,
really
right?
wants to go and get their teeth cleaned, but you know you need to have healthy teeth.
Yes.
And so going in, you are uncomfortable, but it's very short, very quick.
It is very quick.
We try to do everything we can to minimize, the pain and to make you feel more comfortable.
And it's like you said, it's literally seconds, right? Your boob gets smashed. Yes, it does. It's not comfortable,
right,
but it's so quick. But the purpose behind it is so powerful.
Yes.
I want to talk a little bit about breast density.
Yes.
I cannot tell you how many times I've been sitting around, happy hour or, sitting at, having a cup of coffee with it. Oh, I've got dense breasts. So do I. So do I. I don't know any woman who has never said, oh, my breasts aren't dense. Everybody thinks they are, right? So let's talk about that for just a moment. So Corrine, on the website, you talk about that a lot. And even on your app, it's educating women on what that really means. And you're showing us what that looks like, right?
Yeah.
But because we don't know, we don't see that.
Yeah. So if you think about it, so breast density changes throughout your life. It's not exactly the same in both breasts, and it's not uniform across the breast. So kind of think of it like you've got a sky with clouds in it. So if someone, and breast density is A, B, C, D density.
That's how you label them.
D is perfectly cloudy sky, like you cannot see the sun, right? And like on an X-ray, that's going to show up as white. C is going to be lots of clouds in the sky, but not as many. B is going to be mostly clear sky, and A is like no cloud in sight. And so,
is there anybody in A?
Yeah.
Okay.
There are, and we love reading those mammograms.
Okay, because they're easy, right? They're easy.
Yeah.
Okay.
It's like a clear window, but like, I think what people don't understand is that density will change throughout your life. It's part of the reason why mammograms don't happen before age 40, because breasts are very dense. So, people are like, why aren't they giving us a mammogram? You're like, well, it's just not going to be able to read as much because you're more likely to be very cloudy. But what happens is like as you get older, our breast tissue changes. And
Does it get denser?
it becomes more fatty.
Yeah, less dense. Change of hormones.
Yeah.
Oh, less dense.
Yes.
As you age.
Oh,
So,
really?
So you might get a mammogram that says you've got dense breasts one year, and then you go the next year, and it's not reading as dense anymore because your density is reducing.
Which is why it's so important to get that baseline.
Yes,
Right?
yes.
At 40 is the recommended
That
age.
is the recommended,
I
yes.
want to talk about age in just a minute, but I want to stick with breast density because it's so important. So if you have dense breasts, are you more likely to not see the cancer?
First, I want to say, though, I want to clarify, having dense breast tissue isn't abnormal. There's nothing wrong with you.
Okay, it's just your
just
body.
who you are.
Okay,
So
again, getting to know your
It
breasts.
just means you have more active breast tissue, the active component of breast tissue in your breast tissue. It's just who you are. It's genetics.
There's nothing wrong with
There's
you.
nothing wrong
You're not
with you.
broken.
can't feel it. It's not like having perky breasts or something like that. It's something that can only be read like on a mammogram.
On a mammogram.
or
Okay,
ultrasound, like,
it's deep. It's it's the tissue
Right.
within.
It's how the tissue is made up. It's not how something feels.
or hangs.
Yeah.
Correct. 'Cause that also
Well,
changes.
come on.
That also changes as we get older. So it does. The more dense you are, as she's saying, I like that. It's a very cloudy sky.
Yeah.
So it is harder to see through that dense breast tissue because the dense component of breast tissue is white on a mammogram, and cancers are white on a mammogram.
Right.
So if you can imagine, we are trying to find the abnormal white amongst a sea of white.
The needle in the haystack.
The needle in the haystack. But with the development of tomosynthesis, or the 3D mammogram, we are able to now look through your breast tissue. That has significantly improved our ability to read mammograms in women with dense breast tissue. Significantly.
Yeah.
What about women with implants? I hear this a lot, that you can't see around the implant. Has technology improved in that area as well? What should women who have implants know about going in for a mammogram or share?
So when you have implants, mammography is still I'm going to sound like a broken
No,
record,
don't.
but
Keep doing it.
mammography is still the most important thing that you can do
Okay.
to find breast cancer early. When you have implants, it can hide portions of the breast tissue. We do additional images when you have implants to make sure we are looking as thoroughly as possible.
That's why they ask the question, right, when you're
Yep.
filling out the form, because are they gonna do the mammogram differently?
They do it
Okay.
differently.
Okay.
You get more images. You
Okay.
have more images taken when you
Yeah.
when you have implants.
Okay.
So it does, having implants can hide breast cancers if they're on the outer parts of the breast. If the breast cancer happens to be on an outer part of the breast where we just can't see it that well because the implants are covering it or obscuring it. So it does make it a little more challenging. If you have implants and have dense breast tissue, I would really consider getting an ultrasound too.
Okay, so you've got to ask for that though, right?
You do, or if your breast radiologist, when they read your mammogram, they may put a note in there. Hey, you have dense breast tissue. You have dense breast tissue and implants. You have two things that make reading the mammogram more challenging for us.
Okay.
So consider getting that ultrasound because that way we know that we are doing everything possible to find a breast cancer as early as humanly possible.
Okay, really good information.
Which has significant long-term benefits.
Absolutely.
Downstream benefits.
Absolutely. Does it change your baseline if you had one earlier and then you ended up getting implants 10 years after a baseline? Does that?
That's a good question. No, I think, we can still,
Okay.
I don't think, we can still compare to your baseline until if there has been changes. But that is a good question.
Good to know. Good to know. Let's talk, we always talk about age 40.
Yes.
Is when you should get your first mammogram. But I have to tell you, I have interviewed so many women who got cancer in their 20s, in their 30s. The challenge that I have learned from talking to them is that their doctors aren't listening to them. They're getting dismissed. Oh, you're too young. You can't have it. You're too young. So this comes back to know your risk, know your numbers, and how to communicate.
Yeah.
So with this happening, Corrine, part of your education through your platform is helping women talk to their doctor.
Yeah.
Should that happen. So knowing your risk, I think, is really the key, right?
Yeah, absolutely. So on the app, you can answer a set of questions. We use the Tyrer-Cuzick risk assessment, and it will tell you what your likelihood is at your current age of getting breast cancer based on family history and a bunch of other health factors. And then the app will give you what the recommended screening plan is for your specific risk score. And so you can take that screening plan into your doctor and say, here's what's recommended for me. Like, do we agree with this plan, right? And then you can solidify it together and say, yes, we're going to start mammograms at this age, this often. We're going to be adding ultrasound to this. If you have a higher risk of breast cancer, breast MRI is usually recommended. And so the app will explain what to do to prepare for that mammogram, that ultrasound, that, all of the different tests will teach you what to do. But I think the main thing is that nobody cares more about your health than you, because nobody else has to live in your body, right? And I think sometimes we unknowingly put that responsibility on other people. So well, the doctor will bring it up if it's really important.
Right.
Or if I needed to do this additional testing, so-and-so will call me to make sure I get that appointment. And that's, and so for young women who find something, I think the most important thing you can know is you are the only one who lives inside your body.
Thank you for saying that. And that's exactly why we're here today, is because we want to empower you. We want to give you as much information as we can in a short period of time so that you think about this and take control of your body and ask the right questions. Dr. Bravo, when a woman comes in to get a mammogram, if she's under 40, and she might say, if she hasn't been to Corrine's app and has done all of her own homework, she might know that, my grandmother passed away, or my sister, or a close relative, but she might not know whether she's got the BRCA gene or done any genetic testing. What do you do?
So we ask them, what's your family history?
Yeah.
So we want to know family history for breast cancer, not only on your mother's side, but also on your father's side. And we want to know history of ovarian cancer,
so is it all cancers or just mainly the female?
Mainly breast and ovarian, but there are definitely some genetic mutations that will make you at increased risk for developing additional types of cancers as well. So you should know all your family history for any types of cancer on both your mother and your father's side.
Yeah.
The biggies are breast and ovarian, but like I said, there are others.
Yeah. Well, it's because we were just chatting before we started. I was mentioning that my aunt, got cervical cancer at 89.
Right.
What about that? What cervical cancer does that factor
So
in?
cervical cancer, not usually.
Okay, so it's ovarian.
It's
and
ovarian and breast are the big ones. But like I said, prostate cancer is another one. You want to know family history of prostate cancer.
And colon cancer can be connected as well.
Oh my gosh. Okay, you guys got to do some homework here.
You do have to do some homework.
You need to know your risks, and these are all questions that you ask us on the app,
so
right?
with the risk assessment on the Know Your Lemons app, it will ask about all of your family members' medical history.
Right.
And I want to be clear, all of that information stays on the phone. It's not sent anywhere. Like that
Thank
is
you for saying that.
your private information. So that will figure it out. You can also do a really extensive one where you list, like, I have 4 siblings and one of them had this cancer and the other 3 had nothing. It will take that into account in the calculation of like, how prolific is this in your family? So you can get an even more like specific risk if you fill out all of your family members, and it has the list for you to go through. But this is the thing that a lot of people don't understand. I hear a lot of women say, oh, breast cancer doesn't run in my family.
I hear that all the time
mammogram.
too.
I know.
And it doesn't run in my family, but guess what? I was the one in 8.
Yes. So 85% of women diagnosed with breast cancer have no family history of it.
Yes.
None.
The majority of the women we diagnose with breast cancer do not have a family history of breast cancer.
What about the women who are under 40?
That is an unfortunate situation because we are seeing a significant increase in incidence of breast cancer.
Is it because their risk is high though?
Not necessarily. We're seeing a significant increase in incidence of all women of all ages for breast cancer. We don't know why yet, but it's happening. It's happening at a higher rate in women less than 50.
Yeah.
I know.
And so,
Scary.
consider getting that first mammogram, that baseline mammogram. The current guidelines are 40. Definitely get it at the age of 40. Consider getting it in your 30s because we have had times when we found patients who had no physical changes. They come in for that baseline at 35, 36, and we see the earliest form of breast cancer.
Wow.
And if they would have waited 4 more years, 5 more years.
Yeah. So like get that risk assessment, learn specifically when you should be starting and the things that you should be doing. But if you're under the age of screening, so under age 40, and you notice a change and something doesn't feel right to you, you go to the effort to make that doctor's appointment. You should not leave that doctor's appointment without a referral for testing. And so often we have women, so let me tell you about a woman named Lindsay, 24, noticed a lump in her armpit. And she's like, I don't know if I should go. And her boyfriend's like, it's probably nothing, like just check it out. And she saw our campaign on social media a week before she noticed the lump. And then she went, no, hold on. Like I probably need, and it was her boyfriend that showed it to her.
Wow.
And
got
so,
goosebumps.
so she goes into the doctor and they say, oh, you're 24. Like,
You're fine.
child, you don't need to worry about this, right? And she's like, yeah, but because she had seen the campaign, she's like, but I know this can be a symptom. So she's like, yeah, it probably is nothing. I don't want to be seen as somebody who's too persistent. I don't want to like put anybody out, right? Because as women, we're like,
We don't want to inconvenience
we don't want to like
anyone.
ruffle feathers, right?
Not going to cause a scene or a ruckus or push any buttons.
So she had some pushback on that from the physician because the physician's like, statistically, it's not going to be breast cancer. But we don't diagnose through statistics. We diagnose through testing. And so she said, I would just feel better about this if I need a referral. So there's some phrases you can use with your doctor to be like, okay, what can we do to be sure? If
Write that down.
Like, I don't think it's probably not, let's wait, whatever. Say, okay, well, what can we do to be sure? What can we do to get this off my mind as quickly as possible?
I'm not comfortable with this.
I'm not comfortable with this. Or like, the purpose of my visit today is I need a referral because I'm concerned about this. So you having a concern is the only thing necessary for you getting referred for testing. The doctor doesn't need to be able to feel what that lump is. The doctor doesn't need to have any kind of thing. So keeping that in mind. So she did that, and then she was diagnosed with stage 2 breast cancer, age 24.
Oh my gosh.
Right?
Good for her for being persistent,
And
right?
on that same note, I always tell patients, trust your gut.
Yes.
If something in your gut says this is new, this is different, get it checked
Trust
out.
it. Trust your gut,
And,
right?
and how do you know it's new? You know it's normal for you.
Right, because you've been
Exactly.
doing your self-exams.
Exactly.
That's
So you know
okay,
there's a
it's all
change.
coming
Yeah.
together
So
here,
you're
right?
doing your self-exams, you're doing your screening, and those two things combined will put you in the best shape. So like my foundation is global. We're in 77 countries, and much of the world does not have screening, right?
Right.
So to me, it's really frustrating where we're in the US, we have screening that's available to us. It's included in our ACA insurance plans. If not, the state will usually cover it through a state program, right? For instance,
There are so many
Africa.
programs. There's so many
Yeah.
programs that will even help you get and pay for your mammogram. Who
yeah.
will take
We
you
have-
to
we
get
have-
your
we have
mammogram.
no
So
excuse.
you've got to do the research, and I
advantage
know
of it,
that you
yeah.
have that information on your website. I want to talk a little bit about the next steps. So there's the mammo, there's self-exams, mammos, ultrasounds. When do you get an MRI and why?
So MRI, there are a couple different reasons that we use MRI with breast cancer detection. If you are considered at increased risk for developing breast cancer throughout your life because of family history, because of other diagnoses that you have, you were saying that your app has the online calculator, the Tyrer-Cuzick, which is the one that we all use. Tyrer-Cuzick is the fancy name for it. So you plug in all the information about your family history, your lifestyle, et cetera, and it pops out a couple of different numbers. One of the numbers is, what is your lifetime risk for developing breast cancer? If this is 20% or greater, you are considered a high-risk patient. So for these patients, we recommend annual mammography, because why? It's the most important imaging modality,
right.
and adding in an MRI because you are at increased risk for developing breast cancer. So every year, usually patients will start time point 0, having the mammogram, wait 6 months, have an MRI. So their breast tissue is getting looked at and evaluated for breast cancer every 6 months. So we're trying to find those breast cancers as early as possible. If you have a diagnosis of breast cancer, a lot of times the surgeons and the oncologists will want to do an MRI as well, especially if you have dense breast tissue. All the different imaging modalities that we have, mammography, ultrasound, MRI, they all look at the tissue and evaluate the tissue differently. And MRI is the most sensitive, meaning that you get contrast through an IV.
It's not painful.
With an MRI. No, MRI is not painful.
No.
We look at how the contrast is being picked up, how the blood flow is different in certain areas of the breast tissue.
Here's what they said to me: it'll light up.
Yes, yeah, exactly.
If it's there, it'll light up.
Exactly.
Okay.
Yeah, and so that's what we're looking for with MRI. And MRI is the most sensitive, meaning that it finds the most abnormalities. It finds a lot of additional benign abnormalities, which is why we don't want to offer it to average risk women for screening at this point.
Right.
Because it finds a lot of abnormalities that are benign, and then that requires additional biopsies. So at this point in time, if you're average risk, there isn't a need for regular MRI. The mammogram is still the most important.
Would you do an MRI before you do a biopsy?
I would not. That is a great question. I would not, because we want to know, when we're reading your MRI, we want to know, what is this? And that will change how we read the MRI. It'll change our threshold. If we know there is a cancer in the breast, you will be going to surgery. we are more likely to biopsy additional areas because we don't want to leave any abnormality in your breast that could need additional surgery. And so I would definitely recommend having the biopsy, getting the diagnosis, then having the MRI, because it helps us in our interpretation of reading the MRI.
Okay, that makes sense, actually. We were discussing about, and us ladies are funny. We
really are.
We are.
Yeah.
We're funny, quirky, funny, good, in a good kind of way. But I'm sure you have heard these stories, and I'm sure both of you have heard crazy stories of what women won't do. Some women don't want to get a biopsy because they just don't want to know.
Yeah, I mean, that is fear that's generated from a lack of knowledge, right?
Yeah.
And if you really understand what the biopsy is about, if you know that 80% of biopsies turn out to be fine, right, then that's something you can stand on and go like, oh, it doesn't feel so uneasy and uncomfortable, right? And so the main thing is like being able to identify when you're making a decision based on fear because you have a lack of knowledge versus just what comes with the territory of like having to navigate a difficult situation. So bring in family, bring in friends that you know that can support you, because if you get that diagnosed earlier, that can save your life, right?
You want to be educated. You want to be the smart one in the room, right?
And I always say we're quick to biopsy because breast biopsies are so safe, so easy to do. It's a quick outpatient visit. It's a needle biopsy. No preparation for it whatsoever.
You're
drive
numb.
yourself to the clinic, drive yourself home.
Yeah.
We get you nice and numb. Once you're numb, we grab a few tiny little samples. Then we know for sure. If we've diagnosed the breast cancer earlier, the treatments will be much less aggressive than if you would have waited.
And here's the thing I want to say. Had I waited, oh my gosh, I can't even imagine what would have happened.
Right.
I again, one of the lucky ones. If you think about it, if you ignore any symptoms, what could happen is what you don't want to have happen. You don't want to go through chemotherapy. You don't want to end up with stage 2, 3, or 4, or worse, right? I lost my sister-in-law to breast cancer, and I watched it. It was awful. I don't want that on anyone, which is why we're here. Okay, so we only have a few minutes left. So, Corrine, I want to start with you. What would be the one thing that you would walk away, besides doing, being proactive? What do you want women to know based on all of your knowledge?
Your health is in your hands, right? And there are people who are trying to dissuade you from doing what the recommendations are, right? So in social media, they'll say mammograms are dangerous, and then you find out they're trying to sell you something. This alternative test, this magic smoothie that has the right ingredients that will make it so you'll never get cancer, right? Like
that doesn't exist, by the way.
Wouldn't it be awesome if it was?
I was going to say, we wish it does.
Yes, right?
Like, get me those magic beans, let's go, right? So
there is no magic pill.
Right, like being able to recognize things for what it is because if they take that mammogram option off of your list of things you can do to protect yourself, then the only option is the new one that they want to sell you. And So when you see messages like that, know that that's what they're aiming for. They're trying to take an option off of your plate and swap it with something that's that. But I would say, if you've been listening to this whole thing, we've been having these discussions, and you still haven't taken the action, the simplest, easiest thing you can do is download the Know Your Lemons app and take a few minutes to do that risk assessment, understand what you should be doing. It works for any age.
Empower.
Yeah,
Empower.
Like get yourself that knowledge.
Yes.
There's a reason why this app won the best health and fitness app this year. It's
Congratulations on that.
That's amazing.
She beat out some big boys too. So
amazing.
good for you.
We beat Apple Fitness.
So good for you.
Yeah.
Good for you.
Very good.
Dr. Bravo.
Yes.
Words of wisdom, please.
On that note, in your 20s, start recognizing what is normal for you. Because in your 20s, you are at a decreased risk for developing breast cancer. it does happen, unfortunately, but start definitely in your 20s knowing what's normal for you. And please, if you notice something new, if you feel a new lump or bump, any changes that just feel different to you, please trust your gut. You know your body. You know what's normal, what's abnormal for you. Bring it up to your doctor. Get it evaluated. And then certainly at the age of 40, if you are average risk, please consider getting that yearly mammogram. We really want to find breast cancer before you can feel it, before it becomes clinically significant, you know, that you can feel an abnormality in your breast tissue. Right. That's our goal with screening mammography, to find it while it's still really, really small. And the chances of it being curable are significantly higher if it's found on screening mammography before you notice any changes.
Yeah, because the earliest stage, the survival rate is 99%.
I was just going to say, if you've ever, and plus if you've ever watched someone that you love battle this horrible disease, it's awful.
It is awful.
It's awful. I have a tattoo right here on my arm for my sister-in-law, because I, 35 years ago, battled it with her, and none of these resources were available.
Yeah,
right.
So I thank you for creating Know Your Lemons. Thank you for being so good at your craft and for your passion. It's obvious that you are passionate about keeping women healthy, and I appreciate that from both of you. And when was the last time you got your mammogram?
I'm due in March, so it's coming up.
Okay, Corrine, when's the last time?
A couple months ago.
A couple months ago. So here's the thing too. What?
But I want to say thanks to you for having us on, for giving us the opportunity to spread this message, because it is so important. And I just want to add, having a mammogram is uncomfortable. Having a biopsy, it's not fun, but dying of breast cancer is
worse.
Yes,
it's worse.
All
of it's worse.
There's a lot of pain associated with it.
And being able to start these conversations is so good. But you know, like, if you are at that mammogram and you're like, oh, this is really hurt, talk to the technician. They can do things to adjust it. The last 5 mammograms I've had have not hurt one bit.
I've never had a problem with a mammogram. Honestly, I haven't.
Some of that is a little bit of a rumor, again, to like keep you scared. So it's like, no, I'm not going to be afraid. I'm not going to be afraid. I'm going to be proactive.
Yeah.
I'm going to be smart. I'm going to like do what I can to take care of myself and start these conversations with my family.
And no, ladies, you said something to me one time, Dr. Bravo, that made me laugh so hard, because it's true.
Yeah.
Most women will keep their Botox appointment before they do their mammogram. So, you know, come on, ladies, you know, this is about your life, your health. We're always so concerned about taking care of everybody else, right? But if you're not around to do that, then what's the point, right? So every single year, start now, know your risk, or start sooner if they're high. Ladies, thank you so much. I appreciate both of you. And I want to let you know that we have all of their information on our website. Plus, we have other resources. We've done a ton of segments. I've done segments with actually both of you about this topic. So we're going to continue messaging you over and over and over again, so you never, ever forget. Early detection is the key to saving lives. Tell your sisters, tell your wives, tell your mother, tell your neighbor, keep them accountable, because that's really the key. This is a community that we're all in together. And I'm happy to be here today to tell you that I'm a cancer survivor, but I'm going to be honest with you, sometimes I am worried about it. I'm scared, and I'm here with you. And I don't want you to be in my shoes. I want you to live a long, healthy, beautiful life. So thank you, ladies. I appreciate both of you. Again, you can go to the website. You can learn more about Solis Mammography. You can learn more about Know Your Lemons. Just visit ABC15.com/checkup. And once again, we want to thank our sponsor, Pella Windows and Doors of Arizona, for giving us the opportunity to spread this very important message. All right, go out there, make your mammogram appointment. Have a beautiful day, everybody. We love you.